We continue our series for the children. During the summer, kids tend to spend more time in the pool than anywhere else. Today we're discussing what parents need to know about swimmer's ear. Dr. Michael Ramsey joins us today with more information. Dr. Ramsey, thanks for coming.
Thank you for having me.
I remember getting swimmer's ear as a kid, and it is not fun.
It is very painful. So swimmer's ear, or otitis externa, is an infection of the external ear canal. Whereas if you think about regular ear infections in children and the type that most kids get throughout the year, it's a middle ear infection. But with swimmer's ear, the actual canal or the opening of the ear itself will get infected because water will get in the ear. It messes up the pH of the ear canal, and so bacteria and fungus tends to grow in there.
Now, how long does it take to get swimmer's ear? Is there rules of thumb to not get swimmer's ear, things you can do to prevent it?
It can happen just from swimming one time. It really depends on how much the child is underwater. The water source tends to be very important, especially if it's a freshwater source like a lake, which tends to have more bacteria, or a small child's pool at home that typically is not chlorinated. Those two sources tend to get swimmer's ear a little bit more.
What are the first signs of swimmer's ear if your child starts to complain?
Yeah, usually it starts with a little itch to the ear, and then it starts to hurt. And swimmer's ear is very painful, especially when you move the outer ear. And so you can also have pain when you chew or move your jaw. And so it's a little bit more than just a twinge. It's actually a pain when the ear has moved itself.
Okay, and what's the best way to get rid of it?
Right. Usually it's going to have to be treated with drops that's given by a physician. Very rarely we have to treat it with antibiotics by mouth. Most of the time drops are adequate. Sometimes we'll have to put a little wick in the ear to be able to get the drops down in if the swelling is too bad. The biggest thing is going to be prevention, and so making sure that if you're getting in the pool and you're swimming a lot, making sure that the ear canal is dried afterwards. Sometimes you can use a blow dryer that's on cool to air the ear out if the child tolerates that well. But a good solution that's very inexpensive is if you take half a teaspoon of white vinegar and half a teaspoon of alcohol and put a few drops of that solution in your ear when you get out of the pool. That usually will prevent it, and you can make gallons of it for just pennies.
That's a great solution. Now, what about swimming in rivers and lakes?
Right. You're gonna the same thing applies, and so you just are a little bit higher risk of developing swimmer's ear in those situations. So you want to make sure when you get out that you dry the ear canal.
And last question on this, is it something that parents need to take their kids to a doctor for? Are there any over-the-counter medications
Typically,
for this?
over-the-counter medications are used for prevention. It's very difficult if it's in a very early stage and you use it. Sometimes it can work. Most of the time this is going to need to be seen by a physician to make sure that there's no complications and that it can be treated appropriately.
And something as painful as this, and also as close to your brain, and when it can affect your ear or even your chewing,
right.
Definitely something that a physician should be seeing.
Right, right. And complications are not common, but needs to be seen.
Okay, thank you. And if you have any questions for the children, email us at morning@WTVY.com. And if you'd like to watch this or any of our past interviews, you can log on to our web channel at WTVY.com and click on For the Children.